Hello, I'm Dr. Kimberley Jackson, Assistant Professor at the Arthur Labatt Family School of Nursing at Western University. I'm here today to give you a snapshot of a new and exciting publication by our team. Together with Dr. Tara Mantler and Dr. Sheila O'Keefe-McCarthy, our team aimed to understand women's experiences of breastfeeding-related pain. This work, funded by the Women's Exchange, is now published in MCN, the American Journal of Maternal Child Nursing. While most child health experts would agree that breast milk is the optimal and natural form of infant nutrition, breastfeeding is not as easy as some would think. It's a complex learned behavior that's embedded in a gendered, social, and cultural context. In fact, it's often described as one of the more difficult processes of becoming a new mother. While not well understood, this type of pain is commonly experienced in the early postpartum period and is an important contributor to breastfeeding cessation. Despite how problematic this is, up until now, little was understood about how pain was experienced and what this pain meant for breastfeeding women. Our study aimed to explore this phenomenon with respect to how women experience it and the meaning this unique type of pain held for them. Our study used a qualitative interpretive-descriptive approach, conducting one-on-one interviews with 14 postpartum women from southwestern Ontario who were experiencing or had experienced breastfeeding-related pain. Our participants were recruited out of a local public health unit where they attend free infant growth and development and/or breastfeeding drop-in clinics. The findings of our study suggested that women's perception of breastfeeding were initially formed by their personal context and were further contextualized by their experiences of pain, which impacted actions and outcomes. From the data, we identified 3 key themes related to breastfeeding-related pain. The first was the interplay between pain and women's context. For women in our sample, context might be things like cultural beliefs around breastfeeding, personal beliefs about the benefits of breastfeeding, and women's social context. Women express feelings of guilt and self-judgment when they experience this type of pain. The second theme was action enablers and action barriers. Women went to great lengths to deal with their pain and used a variety of formal and informal supports. For the most part, the strategies used a trial and error approach, where women would do anything to alleviate their pain. The final theme was outcomes, which was a cessation of breastfeeding or continuing. And for some women, feelings of inadequacy and guilt were felt while they were considering weaning their infants. For the majority of women in our study, though, they did persevere and continue to breastfeed despite their pain. They achieved a sense of pride and satisfaction and accomplishment with their successes. The findings of our study underscore the importance of both formal and informal supports for success. This aligns well with the current literature. From an implication standpoint, it's important that women have adequate support in place at home with their newborn. In addition, since the literature does not identify a gold standard how to treat this pain, it's imperative for healthcare providers to prevent this from happening in the first place. Finally, this study underscores how distressing and unpleasant the experience of pain was for them. It's important that further research is conducted so that adequate prevention, management, and understanding of this pain is obtained. Thank you for listening. We hope you enjoyed this video and reading our publication. If you have any questions about the study or our program of research, you can reach me at kim.jackson@uwo.ca.